Hi, my name is Angel and welcome to my health fair video. A little bit about myself, I am an S2 trad nursing student from Concordia University. For my presentation today, I will be talking about teenage pregnancy. Specifically for this video, I will be discussing the importance of preventing teenage pregnancies, how to prevent teenage pregnancies, LARCs, or long-acting reversible contraceptives, and resources for pregnant teenagers. At the end of this video, I will be doing a post-test to see if you have learned anything or gained some knowledge from this video. The importance of preventing teenage pregnancies. This topic is important and relevant as teenage mothers may face a lot of consequences, both financial and physical, and greatly impact their lives both short-term and long-term. This presentation is also to bring awareness of different options available to prevent teenage pregnancies, as well as options and resources of when one is currently pregnant. How to prevent teenage pregnancies. There are lots of ways to prevent teenage pregnancies. Hormonal changes play a big role in why teenagers have the urge to try having sex, as well as peer pressure. No matter how taboo this topic is, it's often better to provide guidance instead of judgments to teenagers who are sexually active. Now let's go over ways to prevent teenage pregnancies. Evidence-based practice on sex education. This might be surprising, but the most successful programs aimed to reduce teenage pregnancies are those targeting young adolescents who are not yet sexually experienced. This can start from teaching them in kindergarten in an age-appropriate manner of the anatomy and how babies are conceived. Education and knowledge can be from healthcare providers, nurses, and most importantly, parents. Children look at adults and especially their parents for guidance, and so they play a very critical role to prevent teenage pregnancies. Encourage students to postpone sex until they are older. By doing this, they have more liberty to talk about their options and learn what safe sex is all about, and exploring different contraceptives that would help prevent teenage pregnancies. Promoting safe sex practices for those who choose to be sexually active is very important. Teaching them about STDs, STIs, and HPV vaccination. It's also important to know that birth control and contraceptives don't necessarily protect us from infections. So it's important to use condoms and to be up to date with screenings. Lastly, educate young men. It takes two to tango. Men play a big role in teenage pregnancies, so it's important that they are well educated on what safe sex is and what contraceptives are and different options for it. It's really important for them to have a sense of responsibility in their sexual behaviors. Now let's talk about LARC, or long-acting reversible contraceptives. These are better options as it's safer, more effective, and it's something we don't have to think about. So it is human error safe as well. Examples of LARCs are IUDs and implants. Young teenagers can get LARCs without a parent's permission and they're protected through HIPAA. This is an example of a LARC. It's a Nexplanon. Nexplanon is an implant. It's a thin matchstick-sized plastic rod that's implanted under the skin of the upper arm. It's 99% effective, and it also contains hormones and lasts up to 5 years. This is another example. It's a Paragard, and it is a type of IUD. It is made up of copper and contains no hormones. It's also 99% effective in preventing pregnancies, and it lasts up to 12 years. And then we have Mirena. This is also an IUD, but it is made up of plastic and contains hormones, synthetic hormones, progestin, to prevent sperm from reaching the cervix. This is, again, 99.9% effective and lasts up to 7 years. Now let's move on and talk about resources for pregnant teenagers. Teenage pregnancies can be a crisis for the young mother and for the young dad. Feelings of anger, guilt, denial might be the initial reactions, as well as anxiety, fear, shock, and depression. One option is to go through unplanned pregnancy counseling. These trained professionals can offer advice for pregnant teenagers and help understand every unplanned pregnancy options available. These are just some of the options available for unplanned pregnancy counseling, as well as more information regarding teenage pregnancies. Going to the local health clinics help as well. They can confirm your pregnancy, advise on options based on how far along the pregnancy is, and help connect you to a local hospital for delivery. Another option is maternity homes for pregnant teenagers. If a pregnant teenager is at risk for being homeless due to the situation, they may consider living in maternity homes for pregnant teenagers. They provide housing and other services to women facing crisis situations such as an unplanned pregnancy. A pregnant teen has a variety of options to consider when faced with a situation. Number 1 is to keep the baby. Know your resources. Others rely on their members for support, but if the pregnant teen decides to push through and work, it is possible. Although the thought of going to school and getting a job is difficult, it can be accomplished with hard work and with the right support system. Second option is adoption. This may be a difficult option, but it is an option, and discussing emotional impact for everyone involved is very important. Lastly, end the pregnancy. This topic will be discussed objectively and not based on biases and beliefs. There are many resources that can help with this, like Planned Parenthood. Discuss the risk and emotional impact of it and reach out to your local abortion centers. Now let's test out your knowledge and do some post-test. Which one is an example of LARC? A. Birth control pill, B. Condoms, or C. IUD? The correct answer is IUD. Next question. Teenagers need their parents present to sign consent when getting LARCs at the clinic. True or false? And the answer is false. This marks the end of my health fair presentation. I hope you learned something and that I've provided you some resources on how to prevent teenage pregnancies and what to do when one is currently pregnant. Bye.